Dr. Smith, physical therapist here, and today I'm going to be sharing with you some home health tips. I made a similar video to this about 3 months ago, but I wanted to make a better one with better video quality and audio quality, as well as share some more experience I may have left out in that first one. So that's why I'm making this video today. Now, why should you listen to me about home health tips? Well, less than 3 months out of school, I was able to secure a $100,000 salary in home health, and that's just from one source of income. I used that to fund my other sources of income, and I also used this experience to teach others how to do what I did, and also share my experience of how I got screwed over in those first 3 months with a terrible company in home health, and help other people not go through bad experiences, because one of my main goals is to put bad people and bad companies out of business, because when the clinicians are happier, they're not stressed as much, they have better jobs, they can do their job better, and overall the patients get better outcomes. So not only do I have a doctorate in physical therapy, I also have a master's degree in public health. And one thing that I really believe in is team collaborative care, especially in home care and in patient management in general. We can't just do everything ourselves, even if we want to. We also have to leave our egos behind. And that's a big lesson that I think every profession can learn from our own profession, with the older PTs with bachelor's levels degrees and master's degrees, kind of eating their young, yelling at the doctorates. You got a doctorate degree, you earned it, call yourself a doctor. My scrubs say doctor of physical therapy. They also have my master's in public health credentials on them. You earned it, you paid for it. Use it, respect it. Don't let anyone take that away from you. Okay, now going into this video, I'm gonna kind of cover things that I did last time, which is basic home health tips and how to get the best job in home care and what companies to run from. So I kind of gave an introduction about me, about how as a new graduate, I make over $100,000, and actually this year, within my first year of graduating, and through my own experiences of working for a charitable company and then just being like, F those guys, I'm gonna see what else I can do and go into a better company, I should clear over $120,000 within my first year out of school as a new graduate physical therapist. If you're an older graduate therapist and that pisses you off, I don't even care. If you don't like your system, you don't like your circumstances, change them. Stuff is always negotiable, stuff can always be changed. And I want to give a big shout out to Ben Fung, who was one of my mentors as a third-year student, and one of the reasons that all of this has been possible. He did the same thing, making 6 figures close out of school as well. So what I'm going to say first and foremost is you're going to see a lot of therapy-only home care companies. These companies are usually trash. There is good ones out there. I know people that own some and they're decent, but that being said, if it's a therapy-only company, in my opinion, it's most likely trash, because what's gonna happen is they're actually contracting with real home care agencies, with nurses, have other disciplines on staff, and they are using you as an employee of them through an agency, and it's this whole middleman process where the agency pays them a fee and they give you part of the fee for your work, but they're keeping part of the fee for your work. It's kind of like, again, it's confusing, but just think of them as an unnecessary middleman. It's like if you went to an agency PRN as needed, what would then happen was you would just get paid. Well, what these agencies do is they kind of go as PRN companies, and then they send their therapist out. They mislead new grads, tell new grads that they're gonna make this amount of money, when in reality, they're pocketing $30 to $40 plus per visit, because new grads don't know any better. So that's why I'm not a fan of staffing companies. If you need to break into the industry, they can be beneficial, but I recommend you quit that job early, because you're gonna make more money and it's gonna shed your new grads. If you want to talk about this more with me, I can send you a link and we can do a consult. I am doing free consults right now. Eventually they will be paid in the future, but I've already helped a few people get a lot more money. I have a few people on their way to over 6 figures right out of the school as well. You just have to know the market. I'm trying to educate everyone through knowing the market, through education. So in home care, you can have real home care agencies where they have nurses on staff, speech therapists on staff, OTs on staff, social workers on staff. They might even have home health aides, and they might even have a medical director. Where with the therapy-only companies, it's usually just a few therapists, maybe speech, maybe OT, physio, but if it's just that, again, the reason that I'm biased against it, and it's not because I don't like other therapists, it's just usually people that run them are kind of shitty people. They don't tell the new grad therapists that they're hiring that they're making money off each visit they see. And on top of that, the patients just don't get the best care. Because if you work for an agency that has the nurses and you go to case conference, you can talk to the nurse about the patient. You can talk to the director of nursing about the patient. You can talk to social work about the patient. And it's just easier to get collaborative care. And also just the patient gets better outcomes faster. Where if it's therapy only, maybe you don't go to those case conferences, maybe notes are delayed. And again, they are taking money out of your pocket. Again, there's pros and cons to both sides, but if you're gonna go with a therapy company, I would just cut them out and go PRN. You're gonna do the same stuff if you go PRN. Now, if they say, oh, you need experience, then go with the therapy company because, you know, whatever, it is what it is, but plan on quitting that job early and plan on keeping your resume out there and just going out. And if you own a therapy company and you're watching this, you're probably mad at me right now, but the reality is, you know as well as I do, that if your therapist went PRN and cut you out, they would make a lot more money and you would make less, but it's better for the therapist, not for you. Sorry, buddy, but that's the way it is. So let me go on to my next point here before I go off on a tangent. So yeah, I really do think therapy-only companies are trash. There are some good ones, but again, you're gonna use multiple EMRs, which is another red flag. Any time you're at a job interview and you're not sure if it's therapy-only or a real a real company instead of staffing/therapy-only contract, whatever you wanna call it. If I say staffing therapy-only contract, it's all the same thing. And then there's like a real company that has the nurses and staff. Always ask if they have nurses on staff. If they don't do it unless you have to. And again, that's just the reality of the situation because you'll make more money the other way. Ask how many EMRs you were using. At one point when I was working for a staffing agency, I was using up to 8 EMRs. What this did allow me to do though was then leverage my EMR experience to get a better job, work more. So there's pros and cons there. But again, you can do the same thing PRN. If you want to learn 8 EMRs, just go PRN, get more money. Where else am I going here? So yeah, multiple EMRs is a red flag if you're trying to get a full-time job or a part-time job. And if you're gonna do that, just go PRN, bro. Sorry, ladies, just go PRN. Next thing I'm going to say here is, again, I said, you know, staffing, contract, therapy only, unnecessary middleman. Unless it's like Medicare Part B, but then again, Medicare Part B, you're gonna be getting paid less anyway. So, I mean, if you wanna make money, go Medicare Part A. If you don't wanna make money, go Medicare Part B. It's that simple. Or you can even get your own Medicare number and just go direct or go private pay, or they can sign a waiver. There's so many options there to just cut middlemen out of your money, your salary. If you don't manage your money, you're gonna have a harder time, okay? Now, the next thing you're gonna ask when you're interviewing for jobs is how did they get referrals? Are most of their referrals through nursing homes, assisted living facilities, ILFs, dementia units? Because if that's all it's coming from, they're probably committing Medicare fraud. That's just the reality of the situation. However, if they have a marketing team, they have marketers out there in the community meeting with physicians' offices, they're running Facebook ads, they're running all these ads to get traffic, even though it's home care, then it's legit marketing. However, if it's all like shady facilities, and again, if you're not sure, make an account on Glassdoor. So Glassdoor is gonna ask you for your email, but if you make an account on Glassdoor, you can go in there, you can read all the current employee reviews, past employee reviews, and then when you talk to companies about interviewing for a job, you can bring them up. You know, you don't have to be a dick about it and be like, yo, this employee said this, but you can bring it up, be like, I was on Glassdoor, tell me what happened. And if you see the same thing over and over again, I would ask about their turnover rate. And you know, it's your job, it's your money, it's your happiness. There's no reason you can't ask questions. People are like, oh my God, what are you doing asking about turnover rate? Who cares? I mean, ask for partnership in companies. It doesn't matter. Ask for what you want. If you don't get what you want, you're not gonna be happy. Ask for it. Then this is very, very important. So in home care, you're gonna have frequencies. I have this in my home health mentor course where if you have 8 visits and you can only see them once a week the first week, then you're gonna do like 1 week 1, 2 week 3, 1 week 1. I break this down in my mentor course a bit more, but I always go under 14 for sure. And I learned this from another therapist that actually runs a company in home care, is that if you are doing over 14 visits, it's a med fraud flag. And you don't want to be flagged. Number one, they're going to look into your license. And also if they see the patient has unnecessary services, you can't defend yourself that, oh, my company told me to do it. No, that doesn't work. Your company is going to try to tell you to do that because at least what's changing now. But up until this changes, it's been therapy-driven reimbursement. So the more therapy that the company gets people to do, the more money they make. However, it has committed a lot of fraud, which is why it is changing now to the patient-driven model, where now the reimbursement is based on nursing need and outcomes, which is better overall. But unfortunately, before it was therapy-driven, therapists probably made more money, these companies made more money. However, people always have to go and ruin a good thing because there's a lot of fraud. You know, if you see a dementia patient, no progress, it's ridiculous. So don't let anyone dictate your schedule. At the end of the day, your employer dictating your frequency is not defensible in court. You should know your laws, you should know your license. You did not pay $100,000 for your license or your degree, there's no point. So then we're gonna go into jobs here. So you can get salary, PRN, part-time. For me right now, I'm on salary plus. So I have a $100,000 salary, but if I get my mileage, I get 40 cents a mile, which is a little bit lower, but I've seen it even lower than that. I've seen no mileage, which is messed up in my opinion. If they're paying no mileage, then fuck those guys. And that's the reality of the situation. And that's also because there's a new tax laws, you can't write off mileage. If you're PRN 1099, you can, but if you're not PRN 1099, you can't. So make sure that you justify that, because I've reached out to a few people, or some people have reached out to me and been like, oh, I'm full-time, but I don't get mileage. Please say I can write off my taxes. No, you can't, okay? That's just not true. Whoever told you that is lying to you. Fuck them. So and also when you get a job, if you're full-time, part-time, PRN, whatever, PRN you can refuse, you can pick your territory. Again, the mileage is depending on how you want to do your taxes. However, I would recommend asking for it. Now, if you're doing part-time or full-time, have a defined territory. So for me, I'm actually in charge of a county, and that's because I'm a full-time employee, and then I'm supposed to hit 25 points per week. We can go into a point system. I go into this in my home health mentor course, but the point system is really gonna depend on your company's policy. Some companies really try to screw you over and don't give you points for like oases, and it's like, dude, no. Don't settle for stuff that's not fair. It doesn't make any sense. Don't let someone say, oh, you're a new grad, blah, your license bill is the same as somebody that did this since therapy first came out. So, and I'll show you a chart here in a second. You can see, oh my God, like, why am I settling? So have your defined territory, have your mileage reimbursement, and don't settle for bullshit that you'll see like, oh, I'll give you $5 per house. No, you're actually gonna lose money, you're gonna devalue your vehicle. And what I was saying is, so for me, so I'm supposed to hit 30 points a week, and if I go over the 30 points, I get the PRN rate added to my salary. That is ideal. Also, that being said, if we are low on caseload, I do not get punished. So even if I have a low week, it's not my fault. And I have that written into my contract. I recommend you have it written into your contract too, because your job is not a marketer. Your job is a physical therapist, an occupational therapist, a PTA, a CODA, whatever you're doing, a speech therapist, your job is that. Your job is not to market. So if the caseload is low, you should not be punished, and your salary and your money should not be affected. Again, if it is, fuck those guys. Next thing I'm gonna say here is some people will say documentation at time of service. Here, you're gonna make sure that they give you the ability to do that. I've seen some companies be like, oh yeah, it's time of service. Here's a tablet with no Wi-Fi and no cell service, or with Wi-Fi and no cell service. You're in the middle of nowhere. You can't document time of service. You don't get paid for documentation. You're basically working for free. So if they say document time of service, make sure they give you a device that allows you to document time of service, or you have one already, but ideally they would give it to you, because if they want you to document the time of service when you're with the patient, so you're not working for free later on or cut it into your weekends, make sure that you have the ability to do so. I know the HCHB tablets have this, which is the most repetitive nonsense ever. I hate HCHB. I personally use Kinzer, and I've used all of them, but honestly, if you like HCHB, I guess you like me know it's not actually saying anything. So make sure you have that. And again, don't work for free. And this goes for travelers too. And you can reach out to some travel therapists as well. So travel therapists, are basically come in as workhorses, and a lot of them come into home health because there is high pay in the industry. But even then, do not work for free. Don't document for free. You give someone a little bit, they're gonna take the whole. Just make sure that you stand your ground. You state your education, you state what you do, what you don't do. You don't let anyone bully you or push you around. At the end of the day, it's your license, it's your respect. You might piss a few people off, but that being said, if you're not pissing a few people off, you're not doing something right. And then we go back into the salary versus PRN. PRN, again, you can refuse visits. You can go to a house and be like, yo, this person's a hoarder. I don't want to go back here. There's roaches, there's bugs. Fuck this. So if you're PRN, you can just peace out. Full-time, you usually can't, but you can document it. You can call Health and Human Services. And we're going to go to the next page here. So point scale I kind of went into. And again, I already said don't get punished if the caseload is low. Rates are always negotiable. So I have consulted with people, and this is for free consults, honestly. I've done these free consults. You can see them on my Instagram story. You'll probably see them on my home health mentor course page if you visit it, if I actually activate it. But I've consulted with people who were told that their rate's not negotiable. This is what we pay new grads. They talk to me, I show them what their licenses, bills, what the rates are, and we actually got them more money. We got a few people over 6 figures right now, just from one consult with me. We have people even in pediatrics getting more money and we're learning the industry, we're learning the in and outs. Again, I work with Ben Fung, one of my mentors, who helps with this as well, and you can look at the pulse. And this is what I'm gonna leave you guys with, okay? So there's insurance rates. So this is taken from, this is a med form, you can see this in the Oasis. And what I'm gonna show you guys here is skilled nursing, cost per visit evaluation, $180 is what the insurance is billing. So they're paying $180 for the nursing. Home health aid, $90, right? The home health aid, the CNA, is getting the insurance bill is $90 per visit for that. The physical therapist, this is important, especially if you're in this group where I'm posting this, besides the YouTube channel. The physical therapist, and I don't know if you guys can see it, prove I'm not bullshitting you, $180. The occupational therapist, $180. And if this is reversed, I'm sorry, but you guys can see it. The speech therapist, $180. The social worker, $200. So you see, this is what the insurance are billing. Yet these companies out here, these therapy-only companies, are like, oh, we'll give you $35 an hour. No, fuck those guys. Okay, seriously. And like, I mean, I got fucked over by one of them, so I'm really like not a fan of them. I actually sued them. But you can see these rates. These are the rates the companies are making off of you. And if you're not getting paid close to these rates, you're not making six figures and you're a home care therapist, change your situation, change your circumstances. If you have any questions, comments, complaints, concerns, comment below, send me a message if you want to consult with me. If you're interested in the Home Health Mentor course, let me know. Hopefully this video was helpful. I'll make more videos like this. The rest of it's probably going to be in my Home Health Mentor course. And yeah, I am self-promoting it, but honestly, if you want to know what I did, want to know how I made six figures as a new graduate, and now I actually use that money to invest in my other businesses, let me know, okay? I hope you guys have a good day. I hope you guys go to home care. I hope you guys ask the hard questions. And if you're in a shitty job, sorry, this is carbon, by the way. And if you're in a shitty job and you're like, oh, everything he's saying is what I do, quit that job if you can, or put in your 2 weeks notice, whatever you have to do, leave on ethical grounds, whatever you need to do to level up your standards, level up yourself, level up your pay, and live the life that you want to live by not accepting the norm. The reason this is the norm right now is because you settled, you refuse to take respect, you refuse to demand respect, you refuse to take control of your situation in your life. It's not that hard. Step up and do it.